A self-advocate's guide to pelvic exams. What is a pelvic exam? A pelvic exam checks the vagina, uterus, ovaries, and cervix for signs of sickness and health. Where do you go for a pelvic exam? The exam should only take place in a health clinic or doctor's office. Who should get a pelvic exam? Anyone with a vagina between the ages of 18 and 65 years old. Why should you get a pelvic exam? Your body is important. Even if you are not having sex with another person, your pelvic area needs to be checked to stay healthy. When should you get a pelvic exam? Your healthcare provider will tell you if you need to have a pelvic exam. Some people have a pelvic exam once every 3 years. Other people need an exam every year. Your healthcare provider may also recommend a pelvic exam for the following reasons: family history of cancer, pelvic pain, unusual vaginal discharge or bleeding, concerns about sexually transmitted disease or infections, STI, you are pregnant. What should you expect during a pelvic exam? A healthcare provider will check your vagina. They will use a medical tool called a speculum to make it easier to see inside your vagina. You may bring a support person with you during the exam. There should be 3 people in the room. You may feel pressure or discomfort. You may ask to take some medicine that will help you relax during your exam. You can also ask to be put to sleep. Your exam should take no longer than 10 minutes. It is okay to ask questions to understand the process. It is okay to use your voice if you're uncomfortable. What is a pap smear? A pap smear collects cells from your cervix. Sometimes during a pelvic exam, the healthcare provider does a pap smear. The healthcare provider takes some cells from the cervix using a small brush. The cells will be looked at under a microscope to see if there is cancer or another disease. Your healthcare provider will tell you your results in a few days. For further information, contact your healthcare provider or a nearest Planned Parenthood in Vermont. Contact You First at 800-508-2222 to learn more about eligibility for free screening.